A staff member can be reassured that if they do accept the position here, that they would be working as part of an organized, professionally run group.
These are some exciting times in healthcare, and I think that we have positioned ourselves in a way, in a place that gives the physician an opportunity to focus on being a physician and practice medicine and not worry about the business of medicine.
It's just an amazing place to work. I mean, everybody's always in a good mood. I mean, everybody wants to do the best job of their ability, and they do that. That's what makes a world of difference.
When I walk in here, what I like is I like the camaraderie. I like the teamwork. Everybody comes together and comes up with an idea of what we can do, a treatment plan. And you get to put your input, and you get to take other people's input and realign what you want to do.
An individual private practice where you're managing the books, managing the records, managing the schedules. We're handling that all in-house for the providers, and they just have to focus on practicing medicine.
The conditions right here are ideal because I save from my overhead approximately 10 to 20%.
Being here, everything is taken care of for you. You literally walk into a room, you see your patients, you put a good note in, and everything else is just streamlined and done. And it makes just my life that much easier.
With the care team concept that we've created, we've given physicians the ability to plug in as they feel comfortable. If they want to work 5 days a week, they can work 5 days a week. If they want to work 3 days a week, they can work 3 days a week. If they want to work in the mornings and be off in the afternoons, we have that capability as well. I think it gives them an opportunity to strike that life-work balance that everybody's looking for.
As a multi-specialty practice, every day is different. You have all kinds of different specialties happening in the office. So one day you may be learning about GI and working with the gastroenterologist, and the next day you're on gynecology and you're practicing with Dr. Rodriguez. And so you're never bored. Every day is different, and you get to learn from some amazing physicians who are willing to teach and pass on their knowledge to you as the staff.
I interned here when I got out of school, and Nick offered me a job, and Nick and Karen are great. I feel like I'm family here. I've been here for 7 years.
If you're looking for overall a challenging environment, this is the place. It's one of the few practices in this area, if not the only practice that has this much variety. You're going to add more to your experience here because of the fact that we have multi-specialty physicians.
Not only am I able to do inpatient hospital work, but I'm also able to mix that up with the clinical internal medicine side. So for me, I like that sort of diversity that I have.
It's a very friendly practice, and I think the communication is good between specialty. I'm a registered nurse, so I've been to a lot of practices and I work locally. I just like that there's everything under one roof and easy to get a hold of people. So if I need one doctor or another doctor, I can get a hold of somebody easily.
You've got access to the patients, usually all their lab works, their medications, their office visit summaries, so that makes it real convenient.
Another great thing about LoCicero Medical Group, in my opinion, is the ancillary services that are available. We have ultrasound, echocardiograms, EKGs, stress tests, all different things that you need, hearing tests that make it very convenient for the patient.
They've always done an amazing job of embracing new technology. They've been one of the practices that has made the transition to the world we live in now with regards to technology faster than most others. So it's been very interesting to watch that and to be a part of it. And I've learned a lot from them because of it.
We're always looking for better ways, better tools to improve the care of our patients and improve our work environment for our employees.
LoCicero Medical Group has been around here for 30 years, and my family has been in the medical business since the 1960s. So we're a very well-established group. We have connections to other physicians, hospital ties, medical associations. That helps with patient care, coordinating care when you have good relationships with people, other doctors or providers in the community.
Tampa has a lot of opportunities to continue your education. We have several amazing universities locally at University of Tampa and University of South Florida, and they're always offering courses for medical professionals as well as medical staff to continue learning and pursue further education, as well as local hospitals that offer trainings, and there's always just something that you can learn in the area. They're offering all kinds of stuff all the time.
Having lived in several different markets, different cities around the country, Tampa offers you just a variety of culture, events, entertainment.
I liked the Tampa Bay area the most because it was a metropolitan city. There were a lot of young people here. There were many things to do, sports, water activities, entertainment, and the airport, of course. And to me, this was important. If you want to visit your family, you have to get on the airplane. You can get nonstop flights to different locations a lot easier.
I really love Tampa Bay. I was almost born here, but I wasn't. But I've been here since I was about 4 years old, and I've seen Tampa change over the years, definitely for the better, from a small little town to a big metropolitan city where we have so many amenities. We have access to beaches nearby, Clearwater, St. Pete. The culture is exciting. There's so many different nationalities here, so many people with diverse backgrounds. The educational opportunities are tremendous, both from the grade school level to the higher educational level. And I found growing up here that I was exposed to so much that I never really wanted to move away.
When I think about putting together a care team, I really focus on the procedural technicians, the medical assistants, and our patient care coordinators in finding the right type of people for our practice. We're always looking for people that are energetic, self-motivated, but probably the most important factor is that they're passionate about providing health care and caring for people.